Dr. Osborne here, and today in Web Wellness University, I want to talk about how your tongue and mouth can tell you about your health. There are a lot of physical findings, physical symptoms. If you just open your mouth and look, might give you some insight into what's going on, again, in your overall health. So let's get started. In this first image, we've got what's called a beefy tongue. Some people call it a brain tongue. Some people call it a fissured tongue. But what this can actually tell us, this is actually, if you look around the edges, this tongue is very large, it's very swollen. So part of what's going on is the tongue itself is actually swollen. This is a form of what's also known as glossitis. And this can be caused by a number of different things. One, it can be caused by vitamin B deficiency, particularly vitamin B12 deficiency, as well as niacin or vitamin B3 deficiency. Very, very common to see this type of tongue manifestation. Now, if you look closely at this tongue, there's also right here through the center, there's a V, almost looks like it's more red distinctly than the pink outer layer of the tongue. So this line right through here oftentimes is associated with digestive distress or gastrointestinal inflammation. So if you, again, look at your tongue, if these are some of the symptoms that you're having, these are potential reasons why that might be going on. Let's have a look at this next picture. This is called a magenta tongue. And you notice that it's distinctly very, very red in color. It's not pink. It's moist, but it's not pink like what we would see a typical tongue be. This is a very, very common symptom of anemia, and particularly a type of anemia called macrocytic anemia. This is a type or a kind of anemia where the red blood cells themselves don't mature, they stay very large, and they have a really hard time carrying oxygen. And this is most often caused as a result of vitamin B12 deficiency, or as a result of folate deficiency, or in some cases, both deficiencies. I've actually seen patients with folate and B12 deficiency who had this severe beefy tongue look, and again, goes away if you correct the B vitamin deficiencies. In this next one, you'll see underneath the tongue, you're going to see these black spots. There's one on this side, and then there's a smaller one right here. Now, black spots on the tongue, generally speaking, and this is not 100%, but generally speaking, if you've got black spots underneath the tongue, it's a common symptom or a common issue associated with either liver problems, meaning that your liver could be under duress. So a lot of people that have this will see who are on multiple medications, and these medications have to be processed by the liver. So the liver's under a tremendous quantity of stress trying to deal with multiple medications. We'll see black spots like these showing up underneath the tongue. Now, another scenario where we might see black spots like this would be in someone who might potentially have a spleen disorder. So best thing to do if you look in the mirror and you look under your tongue, you're seeing these black spots, they're new, they haven't always been there, check with your doctor, have them run a liver test, and potentially you might even want to have them run an abdominal ultrasound, make sure there's no swelling of the spleen, make sure that there's no abnormal findings within the liver itself. These next two pictures are really super common and indicative. You'll see the pink in the center of this tongue, but then it's surrounded by all this patchy white. Okay, and you see the same thing in this tongue. This whole tongue is got a white patch around it. So this is very, very common in yeast overgrowth. So where we might see somebody with yeast overgrowth is somebody who's maybe just gone on an antibiotic, and after the antibiotic course is run, what happens with an antibiotic is you knock out the normal gut flora, not just the bad guys, and what that does is it leaves the yeast to overgrow. And so a yeast overgrowth, oftentimes referred to as candida, but there are other forms of yeast as well. Candida is just probably the most well talked about. But this can lead to a lot of different types of problems. And so with a yeast overgrowth, if you look at your tongue and you're tired, or you have general malaise, low-grade fevers, if you have a lot of gas and bloating, if you're having problems with irritable bowel-like symptoms, these are all very common associated symptoms of a yeast overgrowth. So again, if you have this appearance on your tongue, it could be very, very helpful to get with your doctor and ask about antifungals, There are some natural antifungals like thyme and oregano and berberine and caprylic acid. These are supplements that can be bought over the counter that are sometimes very, very effective for a yeast overgrowth. So again, looking at the tongue oftentimes tells us whether our mouth and our GI tract are overpopulated by this particular kind of problem. In this example, you'll see this tongue is actually very, very large. You'll notice the tongue itself almost looks very, well, it does, not almost, it is very swollen. You'll see the little grooves around the edges of the tongue, these little pitting grooves like this. This is very hallmark of tongue inflammation, but also very hallmark of somebody who either has an iodine deficiency or a hypothyroid type of problem. So in essence, the thyroid itself can lead to this type of appearance. This kind of appearance can present itself, especially the scalloped edges of the tongue, can present with magnesium deficiency. Magnesium oftentimes causes a condition known as bruxism, which is when at night when we're going to sleep, we're clamping down on our jaws. So our muscles in our jaws are constantly in a tense mode, and so we're constantly clamping down, and we'll see the teeth actually butt into the sides of the tongue and give this appearance. So iodine deficiency, magnesium deficiency can cause this. Another thing that's commonly associated with this lateral ridged grooving of the tongue is diabetes or blood sugar dysfunction. So it could be pure diabetes. It could also be something like hypoglycemia, where blood sugar is not being managed well or being controlled well. So you might ask your doctor to check your insulin and your hemoglobin A1C and your blood glucose levels, as well as your leptin levels, to see what's happening with your blood sugar. Now, we get a 2-for-1 on this picture. You'll see right here, up here on the upper left-hand side of this tongue, this is the beginning of a fever blister that's starting to pop up on the tongue. This is very, very indicative and very common in viral infections. Sometimes we'll see these little blisters start to form along the edges of the tongue, and sometimes we'll see them on the outer lip in these areas around the upper lip or lower lip, or sometimes we'll see them actually on the cheek itself. And so this is commonly associated with a viral infection, but it can also be associated with a vitamin C deficiency, very, very common, where a person is not getting enough vitamin C. We're going to start seeing the oral mucosa breaking down because the collagen is not forming properly, and we'll see little fever blisters, or what are called ulcers, aphthous ulcers, starting to form. This next picture is very distinct. There's a couple different things. We got a 2-for on this one too. So you can see this is a wider tongue. The lighting and the shading isn't great down here, but you see the lighting is being focused up here because there's 2 distinct white shapes embedded. This is the tonsil, so it's embedded in the tonsil. These are actually called tonsil stones, sometimes referred to as tonsillar exudate. And what happens is these are pus pockets, and so pus is forming, white blood cells are conglomerating in that area. And this is a real big hallmark of somebody who has chronic food allergies, so they're eating foods that they're allergic to on a regular enough basis that it's stimulating white blood cell immigration into the tonsils to protect the body from these allergies. It's also common in people that have infections, so bacterial or viral or yeast infections, as this is the part of the case with this particular tongue. You can see the yeast overgrowth is there. But tonsil stones are also going to cause severe halitosis or bad breath because this is pus pockets, right? These are conglomerations of dead white blood cells and dead debris, and they're going to stink. And so somebody who has, chronic bad breath, chronic halitosis, open up, say, look in the mirror and look at the back of the tonsils. And if you see those little stones like that, you're either getting food that you're allergic to on a consistent enough basis to create them, or there's a potential for an infection that's present. So keep those things in mind. This next picture is a very, this is more of an uncommon presentation, but this is a black streaked tongue. Sometimes you'll see it, the black formation in streaks, and sometimes you'll see it kind of go more round and be more universal across the tongue. But this is oftentimes linked to severe infection, severe bacterial overgrowth of the small intestines, and this bleaches up into the tongue. It's also a sign, or can be a sign, of liver damage. So we might see these types of signs in a patient with cirrhosis or fatty liver disease. We might also see this in some patients who are who have cancers. There are different kinds of cancers that can be associated with the blackened tongue. And I don't want you to freak out if you're watching this video. It doesn't mean that you need to go to the doctor and worry about whether you have cancer, but it is definitely worth looking into and having a checkup done. Some make the claim that this is an oral hygiene issue, although I've never seen a patient who's been able to brush this away with good dental hygiene, brushing your teeth, flossing, etc. Generally, this is something that's coming from deeper. We also see this commonly in people who have severe stomach gastritis. We get acid reflux coming up, and it can, lead to this type of presentation over the tongue. So this is where that cancer risk can come into play, because severe enough gastritis can cause stomach ulcerations that eventually can lead to certain types of cancer. So again, if you're seeing this, it's a good idea to get with your doc or have somebody run a scope into your stomach and make sure that you're not suffering with some type of ulceration or severe stomach gastritis. That would be a smart move on your part if you found yourself with this presentation. The next one, quite graphic, and in this case, this is a severe. There's several things in this image going on. Number one, you can see the pooling of yellow. This is yeast. This is a severe yeast overgrowth, as opposed to just a white discoloration of the tongue. This is a very severe yeast overgrowth. You'll see the white specks across the front of the tongue, but notice how red this tongue is. It's not very pink at all. You'll see there's more of a pink coloration here, but look how deeply red this is. This is such a severe case of glossitis. In this case, it was severe B vitamin deficiencies coupled with severe yeast overgrowth. And a lot of this stemmed from a very severe sensitivity to gluten. So in this particular case, there was a gluten sensitivity underlying the issue, which weakened the immune system to such a great degree that we had bacterial abnormalities and yeast was able to flourish. And of course, gluten sensitivity can also cause malnourishment, malnutrition, and malabsorption. So what you can get is the B vitamin deficiency presentations on the tongue like this, showing the super red discoloration. In this next image, what we're looking at in this one, this is another 2-for image. What we've got here in the corners of the mouth, this distinct red, you can see the crease here. In some people, this crease right here, the skin will actually break open and will start to bleed. But the name for this is called angular stomatitis. And it's extremely common in patients or people who have vitamin B2 deficiencies, as well as iron deficiencies can cause this. So an iron deficiency can lead to this. And again, if you think about it, iron deficiency causes anemia. It's one of the most common forms of anemia. So people who have angular stomatitis like this oftentimes present with severe fatigue, brain fog. They can't think. They had developed shortness of breath, even with short distance walking. If they're not overexerting themselves, they can sometimes get short of breath because of the severity of the anemia. Now, in this patient as well, you can see on the surface of the lip, it's very dry, and you can see cracking within the skin. This is called chelosis, and that's Cheilosis, not key as in Key, but chelosis as in Chei. So this chelosis here, also a symptom of vitamin B2, can also be a symptom of vitamin B3 deficiency. In the case of this, you can see also very swollen red tongue inside the mouth, and this is often indicative of B vitamin deficiency as well. In this case, I would suspect that this patient probably had either some late stage severe alcoholism because of the teeth. You can see the modeling and the destruction of the teeth, and alcohol can do that. But B vitamin deficiency as well. So somebody with severe malnourishment, like a pellagra, which is a severe vitamin B3 deficiency, will sometimes present with glossitis or swollen tongue, as well as these findings of angular stomatitis and chelosis around the lips. And this particular image was actually taken from a database on the National Library of Medicine. So it's not actually one of my patients. All the other images I've shown you were actually patients, but this is not somebody I could say what was wrong with him, but the symptoms are there. The angular stomatitis, the chelosis, the cheilitis, the glossitis are all there as symptoms of again, B vitamin deficiency. So the key here, look in the mirror. If you're struggling, if you're tired, if you find that that you have a lot of brain fog, a lot of the oral symptoms are linked to either infections that can cause these types of general malaise and fatigue and inflammation of the oral cavity, inflammation of the lips. or associated with severe B vitamin deficiencies, or can be associated with hypothyroid diseases, especially the swollen tongue can be associated with thyroid disease and iodine deficiency. So again, these are all potential clues that might give you some insight into your nutritional status, as well as into potential for underlying disease states that you might have that might clue you into paying a visit with your doctor to do a deeper investigation and just rule some things out so you can live healthier and happier. So hopefully this was a helpful video for you. This is Dr. Osborne with Web Wellness University. Make sure you visit us at drpeterosborne.com. You can also find us online at glutenfreesociety.org. Have a great day. We'll talk in the next episode.